This is Turmeric, and today I'm talking about Lumbrokinase. We're comparing it to Serrapeptase and Nattokinase. That's a lot of kinases, benefits, side effects, new studies, and we're starting now. I did not know much about Lumbrokinase, Serrapeptase, Nattokinase until about last year. Even Lumbrokinase, a viewer brought it up to me. I am so thankful for you guys. You guys are on top of the newest studies, newest research. Lumbrokinase is an enzyme derived from earthworms and has been traditionally used in Chinese medicine. It is known for its fibrinolytic properties, meaning it helps dissolve blood clots and improve blood circulation. I did a video recently how blood clots are more common than ever. Over the last few years, they're shooting up, and it's not just viruses, it's not just medications, but we're moving less, we're watching more TV. On average, there's more medications that we're exposed to. There's more things in the environment, and we go over that in detail and specifically why it's happening, what to do about it, how to look out for a blood clot. But that's why people are searching for things like Lumbrokinase, Serrapeptase, and Nattokinase. And you know what? The Google searches on all three of these are like almost 50,000 per month in the United States. These are extremely high. The supplements are actually selling really well. And in the previous videos on Serrapeptase and Nattokinase, people have had really good results. They've actually checked their blood levels before and after, and people are reporting some changes. Lumbrokinase is being studied in conditions such as deep vein thrombosis or a blood clot, ischemic stroke, and myocardial infarctions. It's also for sale as a supplement, and you can see there's some good reviews. There's a lot of sales of this supplement. It also shows promise in areas like neuroprotection, stroke rehabilitation, supportive therapy, and cancer treatment due to the inability to inhibit cancer cell migration and invasion. How does Lumbrokinase work? Well, it's considered to be a fibrinolytic powerhouse. Fibrinolysis is the process in which blood clots are dissolved. Lumbrokinase exerts its fibrinolytic effects by directly degrading fibrin and inhibiting the activity of something called the plasminogen activator inhibitor, or PAI1, a protein that inhibits the conversion of plasminogen to plasmin. Plasmin is an enzyme responsible for breaking down fibrin and dissolving blood clots. Lumbrokinase consists of a series of enzymes that work to break down the fibrin and prevent the formation of blood clots. Unlike pharmaceutical anticoagulants, Lumbrokinase offers a more targeted approach by specifically targeting fibrin and minimizing the risk of excessive bleeding. In the studies, it's been described as a safe alternative for individuals who may be at a higher risk of bleeding complications. The side effects of Lumbrokinase. Regarding side effects, Lumbrokinase is generally considered safe with fewer side effects compared to other supplements. Common side effects include dizziness, nausea, headache, constipation, and skin irritation. However, these are considered to be very mild and tolerable, and in a lot of the studies, nothing too major is reported, save for severe allergic reactions, which are extremely rare. And the thing is, anything you put in your body, anybody could be allergic to, especially with contaminants out there. Remember, these things are not necessarily FDA approved or studied, even though that's taken some hits in public opinion as well. Lumbrokinase can cause gastrointestinal disturbances and has potential interactions with medications, especially those affecting blood clotting, such as warfarin and aspirin. So if you're on blood thinners, just be careful, check with your doctor. It's advisable to stop taking Lumbrokinase at least 2 weeks before any planned procedures or surgeries to prevent excessive bleeding. Lumbrokinase dosage. In terms of dosage, the recommended amount for adults generally ranges from 20 to 30 milligrams, taken 2 to 3 times daily on an empty stomach. However, the optimal dosage can vary based on individual factors like age and health status. For certain health conditions, the dosage might be adjusted accordingly. So let's take a look at the specific Lumbrokinase studies. There is a big study actually going on right now called the Lucent trial. This is a large multi-center randomized control trial involving 220 participants between age 35 and 85 to look at stroke rates. This is ongoing, but this is going to be a high-level study that's going to take a look at this. The results should be in over the next year or two. It's not done yet. They just studied this. Looking at it, that's probably the highest level study going on right now. But again, lumbrokinase, it's a little bit of a newer treatment option. The second study I looked at investigated the impact of lumbrokinase on pulmonary embolism risk. 60 patients were divided into two groups, one receiving lumbrokinase with heparin and warfarin, and another group receiving only heparin and warfarin. So they didn't count just lumbrokinase on itself, but they added it to a group of 30 people. They studied this of daily dosages for 30 days, and they measured essentially how much of that clot resolved. The results indicated significant improvements in the lumbrokinase group compared to the control group, suggesting the combination of lumbrokinase with other anticoagulants could be a safe and effective treatment for treating acute and moderate risk pulmonary embolism. That's when you have a blood clot in your lungs. So the thing is, lumbrokinase, this is pretty new. I didn't really hear about it until somebody actually brought up the comments down below. If you're taking us, let us know in the comments. This is so interesting, and I'll look up any more studies and add these to these videos as they become available. Personally, serrapeptase and nattokinase, a lot of patients watching these videos are getting great results, but there's nothing concrete yet showing that you should definitively take it. On the other hand, there is something like turmeric, which is very well studied, and it does have a benefit as an anticoagulant as well. Check out my videos on turmeric and curcumin. Check those out below.